This is Sally and Margaret. They are happily in a same-sex relationship. They only have one problem.
Maybe. Me too.
This is Margaret. She has a bent fallopian tube. In order to complete this procedure, her partner Sally will have to have eggs extracted and inserted into her uterus. This is Sally. She is going to be going through a part of IVF treatment and extracting her eggs and putting it in her partner's in order to try and conceive a baby. We've decided to use IVF treatment. What does that stand for again?
In vitro fertilization.
That's right.
It's the process of my eggs being inserted into a dish outside of the body with the donor sperm, and then when the embryo is formed, it'll be inserted into Margaret's uterus.
Yes, we found that it's been the most commonly used treatment for same-sex couples like us. If I were to use my own eggs, we found out that it would be a 6 to 10% chance of me being able to conceive using the IVF treatment. This is because as women get older, it decreases the chance of us conceiving.
This is why we decided to use my eggs for the treatment, because the birth rate is 45%.
Because she's younger.
A lot younger.
Just not that young. Younger.
A fair bit younger than you.
Just a little bit younger.
We had to get tests for things like STDs 6 months prior to beginning the IVF treatment.
Yeah, we got tested for a number of things like HIV.
Human immune deficiency virus.
Yeah, syphilis, Hep B, that's
hepatitis B.
Hep B.
We also had to get tested for things like rubella, the German measles.
We've never even been to Germany. Security these days.
So the official day that the treatment started was when I got my preparation period. And during that I had to get blood tests. They just, what did they just check the
Blood, your readings of the blood.
Yeah, the readings, and then I had an ultrasound to check the size of my ovaries, make sure there weren't any cysts or any problems there.
She was all clear, ready to start our journey.
Yes.
After all that was done, you went through some cramps and...
Oh yeah, lower abdominal cramping, but that was fine after a day.
Yeah, and then they had, once the egg was fertilised, they had injected the fertilised embryo into my uterus and having it being attached to the lining of my uterus. And then that's when the embryo started its journey, developing into a child.
From day 21 of my preparation cycle, I had to have 0.1 millilitres of lucrin injected into the skin under my abdomen. This occurred daily before the collection of my eggs. Lucrin actually suppresses the pituitary gland in the brain from producing LH.
Yeah.
LH is the luteinizing hormones. Lucrin prevents this from interfering with the timing of collection. So LH is what tells the body to only produce 1 or 2 eggs per cycle, so it suppresses that. And then there was another one.
Oh yeah, you had another shot for FSH?
FSH, so that was the follicle stimulating hormone. So I had that to produce as many eggs as possible. I had that for 10 days, daily for 10 days, for collection. After a week of injections, I had blood tests to check my hormone level, and then I had an ultrasound.
Oh yeah, yeah.
That was to check the amount and size of the follicles produced. That was all before the collection, the big day.
Had an ultrasound.
There are only 3 main complications that they actually did warn us about
Before we did the IVF
before we even started. The main one was OHSS.
OHSS,
Yeah.
which is
Ovarian hyperstimulation syndrome. That was it. And that's only a complication if you bad side effects that can occur from the medication that we
the preparation step before we did the implantation.
Yes. Luckily we didn't have any side effects. The second complication was a multiple pregnancy, so if we
could have ended up with triplets, twins, quadruplets.
But that did not occur because
the fertilization was controlled.
Yeah, it was a controlled
With the amount of eggs they extracted.
But we were very lucky, weren't we?
Yeah.
None of these affected us, and the whole process went smoothly. So then the big day came. It was very exciting, but it was nerve-wracking, scary.
Exciting for me.
Yes, not so exciting for me actually. I was quite scared. But they told me to relax, and they gave me a needle that put me to sleep, so I didn't actually feel anything.
Yeah, the doctor explained to us what he was going to do, where he used transvaginal ultrasound to guide a needle that was going to go up to her uterus and into her ovaries to gently suck out the eggs and the fluid that was in there. Fluid and the needle comes out and is then transferred into a lab where the fertilization will take place. He told us that around 8 to 15 eggs is the average of what a woman would produce using this treatment.
All we have to thank is the doctors and nurses that helped us through the IVF treatment. A life-changing experience, and we have to thank science for that. Mr. and Mrs. Lol.
Oh, yeah.
Right this way, please. The problem you have, sir, is asthenospermia, meaning your sperm's movement is limited. This disallows your sperm to reach the follicle, as it cannot get there.
Tell us what to do, doctor.
If you're wanting to conceive a baby, I recommend ICSI treatment, which is intracytoplasmic sperm injection. This is a procedure where they inject your sperm into your wife's egg. This is the most commonly used procedure in your cases with couples with infertility problems. You, Susan, will have to go through a process with roughly 4 steps.
You take fertility drugs to stimulate your ovaries to produce more eggs. This is the same for IVF. The eggs are then collected and each egg is injected with a single sperm from your partner or donor. After 2 or 3 days in the laboratory, those eggs are fertilized and transferred into your room by injecting the sperm. After the treatment, your clinic will arrange your date with you for your pregnancy test.
The process you go through, Jonah, has roughly the same amount of steps.
An embryologist will examine your sperm under a microscope and decide whether ICSI could increase your chances of conceiving a baby.
And don't forget this.
Step depends on whether you are able to provide sperm without medical intervention. If you can, produce fresh sperm sample on the day as your partners are collected. Or sperm can be collected directly from the epididymis, a narrow tube inside the scrotum where a sperm and stored are matured. A single sperm is injected into the egg. This does not mean that the egg is fertilized, but ICSI now gives an opportunity that you can conceive a baby using this treatment.
Around 70 to 85% of the eggs injected with the sperm using this treatment become fertilized. The success rate for ICSI is increasing in clinics because they're becoming more experienced with the techniques needed. Clinics find that the success rate is higher for ICSI treatments than for IVF treatments, and the success rate for women under the age of 35 nationally is 29%. Now, Mr. and Mrs. Lol Muffins, there are some obvious advantages to using this treatment, but there are also some disadvantages. An advantage of using ICSI is that it gives men like yourself with infertility problems a chance to conceive their own genetic child without using sperm donor. Another advantage to this is that men who have had vasectomies can also retrieve sperm for this treatment. Can also go through with the process. There are also some possible disadvantages to using this treatment. A major concern to consider is they are more likely to have childhood illnesses, medical problems, or surgery by the age of 5. This is because the technique has not been in use for long enough to tell whether there will be issues for the ICSI babies throughout adulthood. 4.2% of ICSI babies have been born with major malformation, which mainly affects boys in the genital area. It is 3 times higher risk of this occurring in ICSI babies than in normally produced babies. The last obvious advantage to this treatment is that it helps couples with unexplained infertility problems, where there are no other solutions as the problem hasn't actually been identified for them.
A really moral and ethical problem with the sperm injection procedure is that within the natural conceiving, it's usually the fastest and the healthiest one that actually gets to the egg and becomes the child of our genetics. Using the injection, it's usually just any available sperm and they just inject it. So it's sort of like not the same when it's a natural conceiving.
Yes, this is a moral and ethical concern of most couples when going through this process.